This camera's in the way. You won't like this.
Okay. So today, we are going to go into detail on what is expected for you during the clinic lab activity in DSE. This will be a tested activity, 30 minutes per case. There'll be 2 cases that you will be expected to perform. Your proctor will have the chart in a folder, such as this, in front of you. You will start with 8 other students in room 303 at the same time. And it will be timed 30 minutes per case. Your patient-student actor will have the history and answers to review system questions and be sitting on the table in front of you. You need to talk quietly with your patient actor to get your history and review the information already documented on your chart. So when you open your chart folder that you get, you will see a problem list, you'll see allergies listed, medications listed, date of birth, family history, social history, all of that will already be recorded for you on the chart. So you'll be asking your history, present illness questions and review system questions when you start with your student actor. Your patient actor will not know what the physical exam findings will be. However, this is somewhat frustrating in years past, but it has to be that way for testing purposes. You'll be expected when you finish the review of systems to stand up and do the appropriate exam for the patient findings that you have. And then when you finish, you'll raise your hand, the proctor will walk over and hand you your exam findings, your physical exam findings. Based on that and your history that you've taken, you'll determine what lab tests you require. When you determine that, you do not verbalize it to the patient or to the proctor. You write that down on the T-sheet, and I'll have this scanned in so you can see more detail on it. But in the back page of the T-sheet, there's diagnostics listed. In that box there, you'll list which test you want to order and raise your hand. The proctor will walk over to you, look at your list, and hand you the test results that you've ordered. Once you've reviewed those, you'll finish your assessment. You'll write down your diagnoses and your plan in numbered format. So number 1 being the most important diagnoses, number 2, number 3, and after each one you'll write what your plan will be for that diagnoses. When you're finished with your assessment and plan, you're going to write your prescriptions either on the prescription paper provided, or you can write it on the next to the assessment plan of the T-sheet at the side there. You can write which prescription and how to dose it there in the note. You sign your note, close your folder, 30-minute time period will be up, and then you'll be ready to move to the other side of the room where you'll have a different patient actor to do the next case. The patient actors will stay where they are when they come into the room, but the patient or the student PAs will move from one side of the room to the next side to start the second case and have 30 minutes to complete that. So we're going to go ahead and start with a simulated patient experience. I'm going to be the PA. Professor Bean is our patient actor, and then she'll switch roles, and once I'm finished with her history and exam, she'll then be the proctor and be handing me my exam findings and lab results and all that she'll need to be doing. So we'll go ahead and start with...
Can I get you to repeat your whole dialogue right there?
Repeat the whole dialogue? What did I do?
No.
Just one more take, you mean?
Yeah, just one.
Okay.
Yeah. Hold on. I got your framed in and everything.
Okay.
Okay.
Is there anything I should change?
No. Just be mindful. It doesn't matter if you look down, look around. I'm just grabbing this. I'm just grabbing the vocals,
Okay.
the voice out of it.
All right.
So,
Okay. Today we are going to go
Hold on. Okay, go.
Right. Today we are going to go into detail on what is expected for the clinic lab activity in DSE. This will be a tested activity, 30 minutes per case. Your proctor will have the chart in a folder in front of you when you walk into the room. You will wait and start with 8 of the other students in room 303, all starting at the same time. Your patient-student actor will be sitting on the exam table in front of you and will have the history and answers to review system questions. You need to talk quietly with your patient actor to get your history and review the information that is already documented on your chart. Inside your folder will be the problem list, medication list, allergies, social history, and family history that's already recorded for you. Your patient actor will not know what the physical exam findings will be. This may be frustrating as it has been in years past, but it has to be that way for testing purposes. Once you finish your review systems, you will stand up and perform your physical exam on the patient actor, and then when you're finished, raise your hand and your proctor will hand you your exam findings. You take the exam findings and record them on your Tsheet note, and then you would write, you wouldn't verbalize, but you'd write down which lab tests you want. Once you finish that, you raise your hand, your proctor will walk over and hand you the test results you've asked for, and you can start reviewing those before you make your final diagnosis and plan. As you finish assessing the lab results, look down at your note, you'll see that there's a space at the bottom. That's where you're supposed to write your diagnoses in numbered format, number 1 being the most important diagnoses you found, number 2, number 3, however many positive findings you found on that assessment. Next to each diagnosis, you write the plan of what you want to do for the patient regarding that diagnosis, and you can write the prescriptions on the box next to the plan, or you can use the provided prescription paper to write out your prescriptions for the patient. You have 30 minutes from start to finish. When you're done writing all your prescriptions, you can close your folder and you'll be ready to move to the other side of the room where you'll have a second case with a different patient actor to go through that with you. Okay, so now we're going to go ahead and start a simulated patient experience. Professor Bean is my patient actor to begin with, and then she'll switch roles and become my proctor. But in testing purposes, you will have 2 proctors that will be taking care of the room. So your patient actor will only be providing you the history and review systems, and then being there for you to do the exam on them. Okay, so we're going to start my patient.
Do me a favor. Say now we're going to start and kind of go to the corner, like knock on the door.
Okay.
You know, give them that thing. So, okay, ready? Okay, go.
Hello, Ms. Parton. How are you?
Good, how are you?
My name's Kim. I'll be the PA here to see you. And what's going on today?
I've had a cough and shortness of breath for the past few days.
And how did this start?
It just came on.
Okay. 2 days ago?
4 days.
4 days ago? And what happened first?
I just started becoming short of breath, and then I started having a cough.
Are you coughing up any sputum, spitting out any sputum?
Yeah, yellow with some pink in it.
Okay. Have you had any kind of fever or nausea?
No, ma'am.
Any fatigue?
Fatigue.
Fatigue, okay. And I see that you have a history of hypertension and high cholesterol. Is there any other past medical problems you have?
No.
That's not listed? Okay. And you are taking lisinopril and simvastatin every day?
Yes.
Alright. So has this ever happened to you before in the past? Have you had
No.
this sort of cough or shortness of breath?
No.
Have you been able to get around and do your normal activities each day?
It's worse with activity. I try and walk to the mailbox, and it makes it worse.
Okay. Are you having pain at the same time, or just shortness of breath?
Just shortness of breath.
And it seems like each day it's getting worse.
Yes.
Is anything making it better at all?
No.
Besides feeling fatigue, you said you haven't had fever.
No fever.
Have you had any weight changes or appetite changes?
I'm not really sure about my weight, but I'm not really wanting to eat as much.
You said you are coughing up a little bit of yellow sputum. Have you seen any blood with that?
There's some pink in it.
And I see that you are not a smoker. Is that true?
No, I do not smoke.
So you haven't had any known heart history in the past? You've not had any history of chest pain or shortness of breath due to
No, I just had blood
problems?
pressure.
Okay. Has that been under control as far as you know here lately?
I'm pretty sure.
Okay. So what brought you really in today?
It's just not getting any better. It's getting worse. I'm more short of breath, and my cough is getting worse.
Okay. And you haven't noticed any other symptoms such as like ear pain or sore throat?
No, I think there's been some swelling in my legs, though.
Okay. And has that just been here recently, or is that?
Yes, over the past few days.
Okay. Have you noticed any kind of headache or confusion, numbness, tingling anywhere?
No,
You said you haven't had any nausea or vomiting.
no ma'am.
How about, feeling like you're having to go to the bathroom more, frequency of urination?
Actually, yes, I'm waking up a few times a night to pee.
Have you noticed any pain with urination?
No,
No blood in your urine?
no.
I see your blood pressure is 150/100. That's somewhat elevated. Temperature is 100.7, so we'll want to definitely take a look at that. Did you notice if you gained any weight here recently?
I'm not sure.
Okay. All right. So now I'm going to make sure I've finished everything I want to ask for HPI and review systems. And when I'm sure I've completed that, I'll be able to stand up then and start my physical exam. So I'm going to go ahead and review the vital signs, which I just spoke about. That's the first part of the physical exam, Tsheet. And probably going to go ahead and repeat that blood pressure and then start my physical exam. Okay. So you said that you've been feeling short of breath. Have you had, so you haven't had any ear pain or sore throat?
No.
Any swollen glands that you've noticed?
No.
Okay. I'm going to go ahead and take a look at Did you know you had this fever?
No.
Let's take a look at the back of your throat. Does it hurt here?
Mhm.
Here?
No.
Listen to you. Just assess your breathing. You notice that you've had to maybe catch your breath, like a lot of movement in your chest.
No, just short of breath.
Does this hurt here at all?
No.
Yeah, come out of your mouth. You said you're not really having pain necessarily.
No
Just
pain.
short of breath. Okay. Let's go ahead and have you lay down and we'll do an abdominal exam. Legs. Just let it go. There. Go ahead and sit back up. And check your strength. Put your arms out like this. Don't let me push down. Push down on me. Good. Check your pulses. I want you to smile at me, frown, puff out your cheeks, lift up your shoulders. Can you squeeze? Just keep it good. Just check your eyes. Look straight ahead for me. Check your shadows. And then we'll just mark this. I watched the patient's gait to record that on the chart. So now I'm going to go ahead and think about, based on my, raise my hand, and now Professor Bean's going to be my proctor. She's going to hand me my, go ahead, Steve. She's going to hand me my exam findings once I've finished. And then I'm going to take those results and record them on the Tsheet. And as I was going along, I should be recording details of the HPI and review systems as I go. Makes it much easier to do that as you're getting the answers that you are asking. And then with the exam findings that I'm given, I'm gonna record it on the back of the T-sheet, what's positive, what's negative, what I've examined. Based on that, then I'm going to write down the diagnostic testing that I want to do. So I'm gonna check off the ones that are listed, write in the ones that are not, and raise my hand. And then she's gonna review that and hand me what I've asked for. So it'll take several more minutes to review that information. Using that information, my exam findings, I'm gonna start thinking about what is my number one diagnosis, write it down, and write the plan. Number two, number three. So this patient has hypertension and hyperlipidemia. If this was a primary care setting, I would still comment on that, whether it's controlled, whether it was uncontrolled. If I wanted to make any medication changes, I would indicate that on the chart. And I would determine what my main diagnosis is, and that would be number one, what my biggest concern is. So we're not going to go into too much detail about this particular case, but I will complete the T-sheet, show you the problem list, show you the chart, so that you can see then how it's supposed to be completely filled out and turned in for grading. There may also be pictures of x-rays, EKGs, some of the physical exam findings. It's pertinent to the case. We may show you a picture of what that looks like. So similar to what other Alzheimer's you've had, you may have some visuals to look at as well. If you have questions each week about what may come into play for the clinical lab activity, look to see what the clinical skills are that we list each week that you need to study and review. And if there's any other questions, you can ask me about certain tests that you may be given, but I can't really give you too much detail about what each case is going to be. You're just going to have to be ready for whatever may come your way. You won't know whether you'll come in here until we tell you that morning of our class time. We'll then list where everyone's going from that 11 to 12 o'clock hour. So you should study up ahead. You're ready for the clinical skills. You're ready for some of the diagnoses that you think may come your way if you're placed in this activity based on the syllabus. And again, if you have questions, you can ask me, but you should be practicing again. Don't let these skills become rusty. That's one of the reasons that we make it a graded activity, is to keep you on your toes so that you're ready to go out to clinicals and face whatever comes your way in your day.
The only thing you didn't do is recheck her blood pressure. And because if they want to do that, how do they get that? Do they actually have to take blood pressure, or when they could, you know?
Yeah.
Because you open up that can of worms by saying that. Just saying.
Mine did
And
not
you-
video at all.
It didn't. I think.
And you know, when you're doing the physical exam, I need to be on the other side.
I don't know.